Welcome everybody. We're going to get started with our Rock and Enroll Open Enrollment Advocate webinar today. Thank you all for joining us. We've got a webinar that is chock full of really great tools and resources, tips and tricks for success this open enrollment season. So we're going to get started right away with some quick introductions. My name is Julie Eller. I manage our grassroots programs with the Arthritis Foundation, and I'm really excited to help host this series of advocate webinars. We've got some amazing guests with us today. Nick Turkas, our Director of Help and Support, is going to be talking through some Arthritis Foundation resources with you all, and Kyle Romanat, a health insurance broker from Health Market Genius, is here as well to give you some inside scoop on all things open enrollment. Before we get started, we want to let you know that our Arthritis Foundation helpline is here to answer any specific questions that you have about your health insurance and choices that you're making this open enrollment season, and you can call them 24/7 anytime. Nick, I'm sure we'll talk more about this in a little bit, but remember that their number is 1-844-571-HELP. On today's call, we're going to go through a quick set of advocacy updates, shift into open enrollment, and then talk through our Arthritis Foundation resources and general resources that anybody might need for open enrollment this year. If you have questions throughout, we'll be accepting them and answering them toward the end of the webinar, but just type them in your Q&A feature or in your chat feature throughout our conversation. At the end, you'll have an opportunity also to ask questions live, and we'll get into that toward the end of our presentation. So let's keep on moving. We're going to move quickly through our advocate updates for right now. We have a number of really exciting things happening this month and have happened in the past couple of weeks that we want to share with you all. The first is that we had our launch of the Live Yes Arthritis Network on Friday, World Arthritis Day of last week. As a part of the launch, we have these really awesome new forums called our Live Yes Online Community. And within them, there's a whole thread of discussions all dedicated to advocacy in action. So if you have any questions or you want to introduce yourselves to other people who are similarly passionate about advocacy like you are, this is a great place to go on and have some online dialogue and community with people just like you. We also want you to remember to save the date for the Advocacy Summit this year. This year's Live Yes Advocacy Summit will take place on March 11th and 12th. At the Renaissance Capitol View Arlington Hotel. Our Advocacy Summit is open to people of all ages and all skill levels, so whether this is your 100th webinar with us or if it's your first time, this event is built for you. It's a two-day conference. For the first day, we do lots of advocacy trainings based on your skill levels, and then on day two, we take that learning right up to Capitol Hill and talk with our members of Congress about legislative issues that are important to people in the arthritis community. We will be offering travel awards for coming to the event, and they will launch later this month. And so keep an eye on your inbox for updates on travel award applications and registration information for the Advocacy Summit. Two more advocacy updates before we break into open enrollment. We have officially reached our 100 legislative victory milestone with the Arthritis Foundation. We've been on the road to 100 since 2014, and across the nation we have substantially improved access to care because of people like you sharing their stories. So thank you so much for taking action all across the country to make these legislative victories possible. Our next big advocacy victory alert is actually a federal one. We're super excited to let you know that pieces of legislation to help prevent gag clauses from pharmacy benefit manager contracts has been passed into law. What all of that means is that there's going to be increased transparency at the pharmacy counter. So your pharmacist will be able to tell you that if paying for your prescription out of pocket will be cheaper than paying for your prescription through your health insurance. It's a really great way to make sure that patients are protected and able to have the lowest cost available at the pharmacy counter. We're really excited. There's an action alert available that you can send to Congress to thank them for passing this important piece of legislation, and we're really excited to move into a world with greater transparency for all patients. With that, we cover all of our advocacy updates, and I'm going to pass the microphone over to Nick Turkas to talk through open enrollment.
Excellent. Thank you so much, Julie. And I think you're still at the wheel for my slides, so I will ask you to please advance. First, I'd like to say that as we jump into open enrollment season, one of the biggest obstacles for people that are shopping for coverage encounter is some of the terms that insurers use in their coverage documents. And so I want you to be sure to check out our Prescription for Access Toolkit that is available on arthritis.org, and check out some of these great resources, including our healthcare and insurance terms glossary, that will really help you understand what those documents mean and give you a better understanding of what possible costs and coverage options that you have as you evaluate your options. The other good news is that we're going to talk about lots of resources and lots of people that can help you with some of those health care terms as well. Next slide. We are in a very special time for people, and that is the ability to choose a health plan. And there are some open enrollment dates on the screen that typically start as early as October 15th for Medicare. If you've got employer-based coverage, your coverage is typically rolling, and you need to speak with your Human Resources Department. But then our federal exchanges start November 1st. State exchanges vary. So right now it's time to think about choosing a healthcare plan. And I would also say think about upgrading a healthcare plan, because even if you have coverage and you've been working with a provider and insurer for a number of years, your coverage care needs may have changed. And it's always best to shop every single year to make sure that you are getting the best deal and the most coverage for your health care needs. And then you may also have a qualifying event, including birth, adoption, marriage, loss of other coverage, that may make you eligible for coverage outside of these dates.
Nick, nice to be here. One thing that I would also add to what you said is that people should check early their options. For somebody on the marketplace, November 1st is the start of open enrollment, and they want to check early. They don't want to wait till December 15th, the last day. Then websites go down. Things get crazy at that time. Check early and make sure that you have a good feeling about a person you're talking to. If you're not just going to healthcare.gov, you want to get a good feeling about the agent, the broker, the navigator, whoever you're dealing with. Make sure you feel like they know what they're talking about. They're confident, and they're wanting to help you. So that's a big thing. For the people Medicare age, October 15th is the start date. And for them, Part D plans, drugs change every year. They want to evaluate their Part D plans every year. Maybe make sure that their doctors are still in network if they have a Medicare Advantage plan. Just different things that are prudent, and they certainly want to do it earlier rather than later.
Great. So there are some questions that you can consider when you're talking to navigators and talking to brokers and agents, and we want you to make sure that you first consider some of these major questions that all people with insurance need to think about. Things like what type of prescriptions am I currently taking, or will my prescription needs possibly change? Do I have an upcoming hospitalization? Now, certainly nobody plans for an accident, but perhaps you're considering total joint replacement, new knees or new hips, arthroscopic surgery, or are there specialists that you need in addition to your primary care physician, rheumatologist, dermatologist, lupus, you may go to nephrologist. So make sure, even hematologist. So there's a wide-ranging number of specialists, and I would even add allied healthcare, physical therapy, occupational health. And then think about your cost, but not just think about your premium cost, and that's what we pay each month, but you want to think about your total overall cost, including your deductibles, co-insurance, and co-pays, and also evaluate what your in-network versus your out-of-network costs may be.
And Nick, just to add something to that, regardless of whether you're in the marketplace or whether you're dealing with over 65 coverages, you want to look at the summary of benefits for the plan that you're considering. That will tell you what you can expect for different types of coverages, and it can make a big difference. You want to make sure your doctors are in network. You want to make sure that the plan you have is the best for the drugs that you use. Medicare has a nice feature on Medicare.gov. It's a plan finder. It will help you to pick a plan wherever you live in the United States.
Thank you, Kyle. And again, there are some things to look for in the plans specific to you. Again, think about your making an informed decision. So you want to every year go through the process of looking at what type of coverage you have. You want to look at cost versus benefit. So what I would call value. You know, if you're paying a lot in monthly premiums, but you're getting a lot of benefit, you can also, you know, you'll get those monthly explanation of benefits statements, and you can see what would the cost be if you didn't have coverage. That can often help you understand where your the overall value of the plan is. And then again, the drug formulary for many of the clients that call into the helpline and contact the Arthritis Foundation, one of the biggest issues with affordability for care is prescription care cost. And so making sure that your drugs are in formulary is really important.
Just to reiterate that, the Medicare.gov plan finder feature is excellent. It will tell you what your outlay would be for all the different plans that are available in the county you live in. I use that all the time with my clients, and it's the only way to have a specific tool to determine that in the most efficient way possible.
When we're talking about formularies can change. About how often would you expect that?
Generally, their calendar year. You know, if the formulary has changed for you, your drug company, your Part D plan provider will advise you of the changes for the next year, for 2019, for example.
Absolutely. So don't count on the formula you had in 2018 to carry over in 2019. Is that what you're saying?
Yes, that's correct.
Excellent. Excellent. Great point. Next slide. So again, these are specific questions that you can find. You can find all of these questions on the RX to Access Toolkit on arthritis.org. And so I urge you to use this list in your consideration, and I also urge you to even print out and take this list when you're talking to a navigator, you're talking to a broker, or you're talking to someone that can help you with deciding your care. Next slide. Again, and there is an arthritis care checklist that you can find on the RX to Access Toolkit. Again, everyone thinks about their primary care physician, but really evaluate your care that you've received over the year. And I would encourage you, if you've kept your explanation of benefits over the year, or you can go into, typically if you log into your current insurer's website, you have an account, you can look at the number of times that you've used the pharmacy or primary care or other allied care providers, and you will get a better picture of the type of services that you've used and you've been charged for. So it's important to make sure that these coverages are going to be covered in 2019.
It's a good point, Nick. And also, you know, you mentioned the explanation of benefits, the summary of benefits, which is a shorter version of that. That will tell you specifics as to what you would pay to go see a specialist, what you would pay if you had to go out of network to see a specialist, what you would pay if you needed surgery, outpatient surgery, in-hospital surgery, just so you can get an idea. Plus, that's a good way to compare plans. Absolutely.
Again, I urge you to head over to the Your Coverage, Your Care Toolkit, also called the RX for Prescription for Access Toolkit. It's really going to help you first understand your coverage options, determine how your current plan meets your arthritis care needs, and even help you with the denial process. So right now we're really focusing on getting coverage and upgrading coverage. But it's not uncommon to maybe hit some hurdles in accessing care. And there are some great things like understanding how to appeal denied claims, and And I'd also add that Kyle and I have been mentioning that explanation of benefits. There's a sample explanation of benefits with an explanation of the explanation, so you can better understand exactly what that document means and how it can help you in affording care. And if you are overwhelmed, swamped, confused, don't know who to turn to, the Arthritis Foundation's licensed clinical social workers answer questions 7 days a week. They can help you understand your coverage needs, help you make some decisions, walk you through some of these online resources, even send you something in the mail. 1-844-571-HELP is the best place to go. You can also email a question to helpline@arthritis.org. Again, that's helpline@arthritis.org.
Once again, Nick, I want to reiterate the importance of starting early. I can't tell you how many people will wait till late in the game, and then it's very dicey as to whether or not they can move forward with the process because websites go down. I mean, things really get crazy at the end of these open enrollment periods. So start early, number one. Number two, make sure you feel good about who you're talking to, that they're confident, that they want to help you. Number three, be your own advocate. You know, learn how to look at a summary of benefits. Learn how to look at these plans. It's not hard. It's not that long. It's important for you to know what to expect. If you need to have a certain type of medication, what's that plan going to do for you? If you need a certain procedure done, what's that going to cost you out of pocket? So those are all very reasonable questions and good things for you to want to know the answer to.
I'd also add that you may want to think about some additional financial tools to help with affordability, all of which are covered in the RX for Access Toolkit. Things like medical tax deductions and HSAs, HRAs, flexible spending accounts. If you know that you're going to have some anticipated out-of-pocket costs, you could talk with your broker, or you could talk with the insurance, the potential insurance providers, and think about what your costs would be and maybe best ways to save for some of these procedures or to maybe fill the gap.
And just to add to that, Nick, if they're in the marketplace, if you're under 65 and you're dealing with healthcare.gov, there are subsidies that can very much offset the costs, the premiums of these plans. It's not uncommon for me to talk to a family and tell them, hey, your premium is going to be zero. So that can obviously make a huge difference. If you're Medicare age, there's a variety of different plans. Oftentimes, the most common Medicare Advantage plan I recommend is a $0 premium plan. So, you know, there's ways to cut costs, there's ways to evaluate things, ways to handle things in a very financially sound manner. What to bring to an appointment. You know, when I talk to my clients, and we're going to talk either on the phone or in person, or we're going to do an application, you know, obviously they're going to have the basic information like full names, dates of birth, social security numbers. The marketplace generally will require other information specifically to get a subsidy. And it's good if you have that. You might have to have proof of income information or proof of citizenship or maybe visa information if you're not a citizen, some different documents like that. But don't let that stop you from applying because most of those things you do not need initially when you apply. They will give you 30 days or maybe 90 days to provide those documents. So that's a pretty common thing. I tell people, get the application done. We can deal with the requirement in the next 30 days or the next 90 days. We just need to make sure we don't forget about it. So, you know, I certainly don't want to discourage anybody from applying if they don't have documentation that they need up front.
So again, thank you, Kyle. I really encourage everyone to, if you don't have coverage, to do the research to find a way to get coverage. If you feel like you're hitting a roadblock, definitely check out some of these resources like the helpline. Again, 1-844-571-HELP, the Access to Care Toolkit, on the arthritis.org website. And there are some other great websites. I love SHIP, which is the Senior Health Information Insurance Program. Every state has SHIP representatives. They're non-commercial assisters when it comes to finding care. Again, we talked about the healthcare.gov website. We talked about the medicare.gov website. Other organizations like Families USA and Health Reform Beyond the Basics.org can be very, very helpful. And don't be afraid to talk to your pharmacist and physician as well about, any roadblock that they've had with your coverage. Now's the time to do your homework and make those calls. And just like Kyle said, make those appointments early. Start doing this work now because you'll probably need to collect some paperwork and follow up, and you just don't want to be waiting to the last minute to get the best care you can.
Awesome. Thank you both so much for all of this information. It's been really helpful to go through and really dig into some of the resources that are available and some of the things that people with arthritis can be thinking about as they enter into open enrollment. We do have a number of questions coming in through our Q&A feature, through our chat, so we're going to direct them to you now. But if anybody wants to ask their question live, please feel free to hit #6 to unmute your line and ask them now. So to kick us off, I'm wondering if you can give us some advice about how to know if a specialist is in-network or out-of-network when you're looking at plan options.
Yeah, it's a great question. The best way is to go to the website for the company that you're using. For example, if you have a Humana Medicare Advantage plan and you want to know if a specialist is in network, you can go to that site, and they make it pretty easy. They'll just walk you right through the process. You can look up a doctor. My clients a lot of times will call and ask me about that, and I'll help them with that. But you can do it yourself, and it's not hard. So that's certainly a smart thing to do.
Thank you. And Nick, would you be able to repeat the helpline phone number and the name of the toolkit you were talking about before?
Absolutely. The helpline is 1-844-571-HELP, and you can also email your questions to helpline@arthritis.org, and you can go to the RX for Access Toolkit. The easiest way to get there is to go to arthritis.org/toolkits. That's arthritis.org/toolkits. And we have the Prescription for Access Toolkit graphic. Click on that, and that's the fastest way to get there.
Great, and we have one more question coming in just about drug formularies for plans. And I'm wondering, how will you know what the drug formulary will be for the plans that you're evaluating as potential for your health care?
It's impossible to be familiar with the formularies, or certainly with formularies from several different companies. The best way to do it, and trust me, I get a lot of clients who give me a list of drugs, and I have no idea which plan is best for them. But I go to the Medicare.gov website, I click on the Plan Finder function, and it will walk me right through. I can enter all their meds, and it will tell me what they can expect to pay with all the particular plans. So it is a scientific way to evaluate drug companies, to evaluate plans, and to evaluate options. So I use that almost every day.
Is there a similar tool for folks that are looking for care on the state exchanges?
No, there's not, but you can go to the websites for the company. For example, in North Carolina, I can go to the Blue Cross Blue Shield website and I can look up drugs. And it doesn't have to be me. Anybody can do that. They can go to the website, they can look up the drugs, and then they can know exactly what to expect. And that's a smart thing to do.
Hi, Lori Bucalo here. I just wanted to point out that Medicare is also available to those who have been receiving Social Security disability for 2 years or more. And so it's not just for people over 65. Any Medicare beneficiary can contact their SHIP counselor during the annual enrollment and get some help with their choices.
Absolutely. Good point.
Absolutely.
Awesome. Are there any other questions that people want to ask live? Just hit #6. Awesome. Well, thank you everybody so much. And I would say for any of the questions that we didn't get to today because of whatever specifics in the personal question, please give a call to the helpline or send an email to help@arthritis.org and ask the questions that you have for your specific health insurance questions particular to your plan. Outside of that, thank you all for participating today. And if you need any other follow-up, please feel free to reach out to our team anytime that you need. You can reach out to me at jeller@arthritis.org. But a special thank you goes out to Nick and to Kyle for joining us today. It was really great to have you on the call today. We'll be having a recording of this webinar online shortly, and we look forward to guiding you through this open enrollment season. Thank you all so much, and we'll talk again soon.